So spinal stenosis could refer to the changes that we see on the x-rays and scans, and that means the narrowing in the space available for the nerves in the spinal canal. And sometimes people use the phrase spinal stenosis to describe the constellation of symptoms that people get when they have this condition. And typically, people with spinal stenosis will complain of pain or heaviness in the legs, which comes on as they walk or stand for long periods. Spinal stenosis is diagnosed mainly on the patient's history. So if a patient tells me they have heaviness and numbness and perhaps some burning in the legs when they walk longer distances, I'm very suspicious they may be describing symptoms of spinal stenosis. Some things like sitting down may make the symptoms better. Alternatively, they may find that leaning forwards or leaning on a trolley when they're in the supermarket makes symptoms better. And to me, that all suggests spinal stenosis. We would confirm the diagnosis by getting an MRI scan of the spine to show that the space for the nerves is restricted. We all get wear and tear as we get older, and we see wear and tear in children. The chance of having wear and tear is higher the older we are, and it's a very slow process that happens across our entire lifetime. So the X-ray changes of spinal stenosis come on very slowly. Patients may describe symptoms coming on the same way. Sometimes they may have a flare of symptoms and they suddenly notice a worsening of their leg pain. But in general, it's a condition that tends to be stable over time. Not everybody with spinal stenosis requires treatment. If symptoms are manageable and we watch symptoms over a number of years, about 70% of people's symptoms will be the same over a period of 4 or 5 years. 15% of people will have symptoms that get worse, and 15% of people will have symptoms that improve a little bit. If symptoms are not manageable, then there are things we can do to try and improve their symptoms. So there's some evidence for physiotherapy. There isn't any good evidence for any injection therapies, but there is evidence for surgery. And surgery, as a treatment of last resort, has got a 70 to 80% chance of improving people's symptoms of spinal stenosis.